The weather forecast with Akendogas.
Good evening, ladies and gentlemen, and thank God for ushering us into a brand new, beautiful week. And thank you for joining me once more on the weather forecast. Between tonight and tomorrow morning, we expect a calm weather in most parts of the nation, with a thunderstorm experience in other parts of the nation, like the southwest and the littoral regions. Now, we expect a minimum temperature of 17 degrees in the northwest, 19 in the west, and the south as low as 21 degrees. Now, the center and the east regions will experience a temperature that is as low as 22 degrees. Now, in the littoral tonight, there may be a thunderstorm experience except for Yabasi, and by morning there would be no chance of precipitation in the littoral region. We take you to the Adamawa region, where tonight there may be a thunderstorm experience in the town of Banyo, and by morning it may rain heavily in the town of Tibati. And lastly, we go over to the southwest, where tonight there may be a thunderstorm experience in the entire region, and by morning there would be no chance of rainfall in the southwest. Now, to protect yourself and others against the coronavirus, you should avoid greeting by handshakes, keep a 1 meter distance, and of course, in case of symptoms, call 1510. Good night.
Coming up tonight, government has created 300 more spaces for coronavirus carriers as infections increase by the day. Medics advise the population to intensify protective measures and be safe. Israel has announced that it will be providing its know-how to help produce masks for health workers fighting COVID-19 in the Republic of Cameroon. And it is official. Cameroon's public broadcaster CRTV and ministers in charge of education have launched teleteaching to help students respecting COVID-19 protective measures at home. The details right now. Thanks for watching the 7:30 news on CRTV. I am Moki Edwin Kinzeka in Yaoundé. We begin with this press release from the Ministry of Defense. It reads, the Minister Delegate at the Presidential Republic in charge of defense hereby informs the population as follows. On Sunday, April 5, 2020, at about 10 a.m. or 10 p.m., 2 young boys found themselves under a street lamp located in the vicinity of the government primary school and the traditional chiefdom of the Blama Kamsulu neighborhood, Amchide area in Mayosava division of the Far North region, carrying explosive charges that they immediately activated. The simultaneous explosion caused death and distress among the people present on the site. The human toll of this gruesome attack is as follows: 10 civilian deaths, including the 2 suicide bombers, 14 wounded, out of which 10 seriously. All the wounded were evacuated to the Mora District Hospital in the Far North region of the country. From investigations carried out and exploitation of the survivors of this tragedy, it is quite clear that it was a suicide bomb attack. The investigations opened by the competent Territorial Gendarmerie Brigade will determine the details of this attack. It is signed, the Minister Delegate at the Presidency of the Republic in charge of Defense, Betty Asomo Joseph. More space is being created in Yaoundé to quarantine people infected by COVID-19 as the numbers rise in the country. Tents have been erected to host 200 patients at the Yaoundé Military Stadium, while a building which formerly hosted one of the capital city's supermarkets has been transformed to a space for COVID-19 potential carriers. Beatrice Losamba reports.
The game is expected to start in less than a week at the military stadium, newly acquired host center for COVID-19 patients in Yaoundé, the epicenter of the disease. By then, it will all look like a hospital here. The transformation started on April 3. The turf is paved with planks and stands are erected on the 2,000 meter square space. The team tells us it works day and night to deliver at the speed of lightning in 2 days' time. The Yaoundé Military Stadium space provides 200 beds, nursing wards and reception halls, plus toilets. A newfound center for quarantining as Cameroon rises up to a bigger challenge of the coronavirus pandemic and might soon be counting its infected in thousands. In search of more space, the Ministry of Public Health ran to this former supermarket in the nation's capital. The occupants left for a bigger place in 2018, and little did they know they were making space to satisfy a great need someday. The place now comes in handy, offering 3 stories with a capacity of 400 beds for COVID-19 patients, plus the comfort of an air-conditioned space. In only a matter of 7 days, the government has obtained 600 more beds for COVID-19 cases thanks to the 2 new hosting centers. And the capacity to host keeps growing at Olembe, the low-cost house site. Hundreds of empty apartments, soon to become quarantine space as the COVID-19 cases grow by hundreds in Cameroon, forcing the government to give a more robust response.
The wearing of face masks has become common in the nation's capital city, Yaoundé, as each and everyone is afraid of contracting the coronavirus. The practice is being encouraged by health officials through sensitization campaigns to limit the spread of COVID-19. Ewane Epule reports.
Offices, workers, traders, travelers and people on the streets in the city of Yaoundé have adopted wearing face masks to cover their nose and mouth, the main infection passage of coronavirus.
I get the mask from the house. My wife has given me. Every time I have to re-put it. Sometime I remove. Where there's not many people.
This is the 3rd one. After 2 hours, we know that you must put off and wear a new one.
Tailors are making brisk business from the face mask.
The material that we are buying to sew this mask is very nice. The day that God gives us the power to work very well, we can do 100 masks. We are selling one mask to 500. We are see that everybody like to have the mask.
As the struggle continues to limit the spread of the COVID-19 pandemic, health officials, NGOs, and heads of public and private structures, as well as municipal authorities, have multiplied sensitization campaigns to encourage all and sundry to start wearing face masks.
The ambassador of Israel has made known his country's plans to help Cameroon in the production of masks for health workers combating the spread of the coronavirus. His Excellency E.C. Yanuka was today granted audience by Prime Minister John Gute. Sisako Tamko reports.
Each country facing the coronavirus pandemic has adopted different strategies on curtailing the spread of the disease. And as Cameroon tries to figure out how best to flatten the curve and save lives, and with health workers at risk of being infected, Israeli Ambassador His Excellency E.C. Yanuka says he's launching a project of providing protection masks for caregivers, nurses and doctors in hospitals using Israeli technology and donated by an Israeli software developer.
It's being printed in a 3D print house at the École Polytechnique. So it combines, it's a great combination of Israeli technology and things, and the masks are made in Cameroon 100% by people from Cameroon.
If produced in large quantity, it could be exported to different parts of the world.
Because the 3D printing center at the École Polytechnique is the most advanced in the continent. They have 23 printers. Our partners is UN OCHA. They actually also partners in the production, and they will handle the delivery. They'll deliver the masks to hospitals around the country, especially to places where we can't go.
There's complete shutdown in Israel with 8,611 registered cases. Besides passing an emergency law to use mobile phone data for tracking people infected with COVID-19, emphasis is laid on protecting health workers in the country.
Medics handling confirmed cases of COVID-19 say not all patients need breathing assistance. The medics say people with emergency COVID-19 signs and symptoms such as respiratory illnesses are those that may need resuscitation ventilators to help them breathe. With the rise of COVID-19 cases, Cynthia Sapala looks at the ability of hospitals in Yaoundé in terms of resuscitation coverage.
It's the question with no exact answer from competent authorities. What is Cameroon's real capacity in terms of respirators or resuscitation ventilators? Unable to get an answer from some medics in Yaoundé, we called Douala. Reached by phone, Dr. Jean-Paul St. John, the president of anesthesiologists, says the current number of respirators will not fit demand if the cases of COVID-19 are severe.
If we must talk about numbers, in Douala, for example, ventilators adapted for our intensive care units, we have about 15. That is why the objective is to get the population to respect the 13 measures outlined by the government.
With medics underlining that majority of cases of the coronavirus may not need assistance in breathing, some are, however, willing to expose concerns on what will happen should the need arise.
It's just like saying you have 15 cars. The question is, do you have the necessary personnel to run 15 cars 24 hours, 7 days a week? In the market, you will find different types of ventilators. A new one is about 2 to 3 million francs and a second-hand 1.5 to 2 million francs. There are also possibilities of local production.
Health professionals also add that inquiring about ventilators is at a third stage of the COVID-19, whereas earlier on, CT scans are needed to diagnose the importance of the respiratory distress.
In terms of the equipment, generally speaking, including private and public facilities, we are above 15 CT scans that are functional right now in Yaoundé.
These days, a CT scan is about 200,000 francs to 250,000 francs CFA, according to a radiologist. As concerns ventilators, the price for one is a lot higher, with countries like the USA bidding a lot of money for more.
COVID-19 cases continue to increase in the country in spite of government's efforts to stop its spread, an indication that some people are still indifferent. Some inhabitants of Yaoundé are asking for rigor and sanction against people flouting recommended protective measures. Some are even asking for a complete lockdown. Constantine Baum gathered their reactions in this report.
The 13 measures put in place to curb the spread of the virus demonstrate government's commitment to fight the disease. The challenge the nation faces now is the deliberate flouting of the prescribed measures. For a better control, some inhabitants believe a more restrictive approach will greatly help curb the spread.
People are not following the 13 points. You still see people mixing up. You still see people, even in drinking spots so close to each other.
If the government has to think again, the only option, according to some of the inhabitants, is for a total lockdown of Yaoundé, Bafoussam and Douala, towns mostly affected by the virus.
The government should go for a total lockdown because I think with this, they will be able to limit the number of infected persons. Since the disease does not move, we are the ones who move with the disease.
There are some people who don't buy the idea of a lockdown as they believe it will affect the economy.
What it should be done is to put an emphasis of the feeding. You have to eat some kind of food, and we have to avoid alcohol, and we have to make emphasis on the wearing of mask.
However, if a complete lockdown will create a very challenging situation, the recent restrictive move implemented by the Southwest and West governors forbidding people from drinking in bars is being appreciated in the central region.
To me, that is even a semi-complete lockdown, because the tendency is that when once you sit and you begin to take alcohol, for that matter, your attitudes and your behavior equally changes along the line.
To do a complete trace-off is very difficult, given that once in a day like this, you come in contact with so many people, and to trace your movement throughout the day will be very difficult. But what government is doing, trying to trace, is still good, but I think it's not really very successful when it comes to that, as compared to lockdown.
The number of infected persons continue to rise as a result of the behavior of some Cameroonians who have defied state measures put in place to curb the spread of the virus.
The African Union has established a continental response plan to deal with the coronavirus. The continental body's most senior official in the country, Mr. Emela, spoke in an exclusive interview with CRTV. Charles Ebune reports.
Almost 2 billion people are infected with the coronavirus, with plus 65,000 others dead globally, and Africa remains the least affected geographical area. The situation in Africa, as from 9 a.m. today, stands at 9,198 COVID-positive cases in 51 states, with 414 deaths and 813 recovered cases. A continent with plus 1.3 billion people, the Continental Organization, the African Union, is mobilized to world coronavirus expansion. Last April 3, African Union Chairman, South African President, held a video conference with about 14 leaders, including the Director General of the World Health Organization and the Director of the African Center for Disease Control. African health and other key ministers have also met to harmonize the continental response of their states. $12 million toward the expansion of the disease, and 4 million others mobilized for the African Center for Disease Control. The African Union lauded the Cameroon government response to the coronavirus pandemic. Measures taken by the Cameroonian government, by the President of the Republic, are in line with those of the World Health Organization. The decision taken by President Paul Biya falls in line within the framework of the African Union solidarity realities. And what about the media outing of some French medics that Africans be used to test a possible anti-coronavirus vaccine? The African Union is yet to make an official statement on that French medics proposal. One thing remains certain: Africa is worried by the progression of the coronavirus on the continent.
Pupils and students who have been at home as part of measures to contain the spread of COVID-19 have begun receiving lectures over Cameroon's public broadcaster, the CRTV. The exercise, initiated by CRTV and the Ministries of Basic and Secondary Education, will enable children in examination classes to catch up with the lessons before the end of the school year. Cynthia Etim reports.
It is day one of the live broadcast on special classes for pupils and students in examination classes. Learners are schooled via airwaves over the state broadcaster and on CRTV web's French and English language at the subjects Class 6 pupils in the French subsystem of education receive for a start. #Focus sur les examens is CRTV's initiative in collaboration with the Ministries of Basic and Secondary Education.
The prevailing circumstances in the country motivated the CRTV, conscious of its public service mission, to put together this distant learning program.
CRTV hopes to help the structures in charge of education give a 100% coverage to the pedagogic program amidst the health crisis.
To complete the work that the children did not do since school ended prematurely during the second term as a result of the pandemic.
Backstage, those involved in the special live production are tireless. The program must be a success.
Day one, so far, is so good. There were little imperfections, little things that could be corrected. Of course, that will be done.
The special live broadcast will be on all CRTV platforms Mondays to Saturdays.
Some families in the capital city, Yaoundé, have reacted favorably to the lessons and say it will occupy their children who have been bored at home. Alice May visited some homes in the nation's capital to find out how both parents and the students were reacting to the classes.
Television studies is a new system of learning adopted by the Ministry of Basic Education in partnership with CRTV as one of the measures to fight against the spread of the COVID-19 disease. It is to assist children who will sit in for the first school leaving certificate examination scheduled a few weeks ahead.
We have small.
French and English language are the lessons offered today to the pupils.
I have understood that the subordinate clause can be introduced by the word who.
Parents are also invited to assist the children for more understanding.
Do you understand what they are saying? The teacher is explaining the different types of subordinate clauses.
Some pupils express their satisfaction with the television classes.
I enjoy the lesson and I wish it continues every day so that I can succeed in my first school leaving certificate exam. The lesson was interesting. It felt like I was having lessons with my teacher at school.
The lessons will be holding every morning on TV as from 8:30 a.m. to 9:30 a.m. In case of any doubts, the toll-free number 8018 is available for questions and response.
Some parents in the far north region have also lauded that initiative. Sylvester Temken reports.
Let us read more antonyms on a table.
At exactly 9 a.m. at the Domayo neighborhood in Maruwa, peoples were glued to their television sets. This time not to watch cartoons, but for televised lessons, alongside their books and pens, while parents watched them closely to avoid distraction.
On the television this morning, at the CRTV station, Madame taught us about wars and opposites.
The operation has come as a welcome relief for several parents who have been wondering what will become of their children at home.
I think it's a laudable initiative because the government, through the Ministry of Basic and Secondary Education, they need to accompany the students. We cannot just allow the students stay at home like that. If not, they are going to be lost at some point in time. So the initiative is a welcome one, and it is going to, revive the children. We are talking about online or digital learning. We need to put it into application because with the current crisis that is going on in the world, that is equally affecting our country, we need to keep the students or the pupils in line with the programs of learning. The
regional delegate of basic education for the Far North region, Amidu Sandazwa, has also promised to take all necessary measures as stipulated by the ministry, notably working with community radios as well as getting materials printed on hard copies for distribution.
A number of people have been able to develop business opportunities from the coronavirus pandemic. Manufacturing of masks and the processing of hand sanitizers are just some of the opportunities people are grabbing, and as Clarice Aritakan reports.
Prior to the coronavirus pandemic, this tailoring workshop in Yaoundé had the usual order of garments. That has changed in a few days. Masks have made their entry into the business.
We started making masks recently because of the virus. If we have better equipment, we can make hundreds of pieces daily. I sell one for 500 francs.
Same scenario here, a few meters away. The orders for masks have been steadily coming in.
We have received many orders lately. We use different fabrics and they are easy to make. A piece is sold at 200 or 500 francs.
Customers have their reasons for choosing locally made ones.
These ones are cheaper and can be used more than once. We just have to keep them clean. I ordered 5 for my family. I prefer these ones because they are cheaper compared to those sold in pharmacies. They are also easier to maintain.
Not really a business born from the coronavirus, but a sale of buckets with water faucets has slipped.
I can sell these at 5,000 francs. The price has gone up because the parts have also increased in price. We have all kinds of customers. We have had orders for 30 or more buckets.
Hand sanitizers, yes, but even more are those made by individuals of different walks of life and sold at various street corners. The packaging is as different as the manufacturers. Users confess they prefer local, though unknown brands because of affordability. The alcohol content is what matters, they add. Online activities have also blossomed, with home deliveries gaining grounds. While the world battles to stop the spread of an unseen foe, for some, new business opportunities have emerged.
The number of persons tested positive for coronavirus today in Cameroon has increased by 8 cases. It is a reassuring increase, which the Minister of Public Health calls indicative of a dynamic response plan that the government of Cameroon has put in place. Now, we'll try to get in touch with Kilian Dandifon, who has updates live from the Emergency Operations Center. Kilian, good evening.
Good evening, Edwin. Good evening to everyone. Welcome to Public Health Emergency Operations Center here at Mesa in Yaoundé, where you have experts working on coronavirus situation in Cameroon. To give you updates, on Friday, Cameroon had 289 cases. On Saturday, the country registered 509 cases, and yesterday, Sunday, we leapt to 650 cases. Today, with the expert here that I have, he's going to tell us what the situation is like today. Dr. Eric Tandy is a public health doctor in the Ministry of Public Health. Good evening, doctor.
Yeah, good evening, Kilan.
What is the situation today, given that we know the figures have been increasing within the past 4 days?
Thank you very much. As of today, the situation is still on an increase, like we expect it to be, because we've gone on offensive in the community in order to massively test the population so that we can disconnect the chain as far as this disease is concerned.
You're talking about testing, and we are told when we read around the world, we know testing is a problem because just getting the test is a general problem, an international problem. But in Cameroon, we are told that those who do the test have difficulties getting the results of their test. How do you explain this?
Yeah, before, you know, from the start, it was only the Centre Pasteur Institution in Yaoundé when COVID-19 started, when we recorded the first 2 cases. But with decentralization, other regions have been mapped and given the possibility also to test. Here we're talking of the littoral region that has also started to run this test. So it's no more a problem. What happens is once results are being, once tests are being run, results are equally issued.
Now, the procedure as of the prescription of government is that when somebody is a suspect, they should call. But what we noticed today is that some people directly leave their houses to private clinics. How do you explain this?
We cannot stop people from making a choice on where they have to seek for medical care. Medical care is optional based on the individual. It is for the institution to deem that based on the symptoms that this individual is producing, it calls for concern for the health facility, irrespective of if it is private or not, to call the appropriate service.
Now the testing is general, it is concentrated in Douala, not even in the littoral. What is the situation in other parts of the country?
It's not only definitely. If I use the example of littoral, it's just simply because we're running some samples there, you know, with the decentralized process that we've put in place, or the Ministry of Public Health in collaboration with the Ministry of Territorial Administration and other governors have mapped that all regions are being concerned under the management of the governors.
Okay, that is the situation. There is an increase as usual as projected, but we are told that the increase has not gone in a geometrical progression again. The increase is rather reassuring. Kilian Dandifon, live from the Public Health Emergency Operations Center, Mesa Yaoundé.
Thank you very much, Kilian. Thanks for being there live. Now, we move to Douala, where two major elements have been highlighted in today's regional committee meeting to fight the COVID-19 pandemic in that part of the country. They include moving airline passengers quarantined in hotels to hospitals and re-strategizing on how best social distancing can be respected in public places. Our reporter, Mercy Ashu, is standing by on the line to Douala. Mercy, what is new this evening?
Welcome to the banquet hall of the Littoral Governor's Office, where I am standing at the moment, and I'm taking part in the regional committee meeting to fight against COVID-19 here in the Vuri division. To be more specific, it is presided at by the Inspector General in the Littoral Governor's Office, Mr. Abubakar Njikam. And just what is coming out of this meeting today, first of all, I must say that he's giving some instructions on how administrative officials and medical practitioners need to re-strategize on how to curb the virus here in the Vuri division and in the littoral in general. I must say that the first instruction here that he gave in today's meeting was to ensure that all persons who were taken from the airports and quarantined in hotels should leave the hotels latest midday tomorrow, Tuesday. And this is an instruction that as the governor's representative indicated, they should move them to the hospitals that have been put aside for COVID-19 cases. The second thing that is coming out of today's meeting as a measure to re-strategize is on how to implement social distancing, especially within the transport sector and even in markets. As you jolly well know, in our markets, especially in Douala, there's a lot of rubbing of shoulders and all of that, and even the bike riders do not respect social distancing. So the officials here and even the medical experts are proposing that the administrative officials re-strategize and put in place some measures to ensure that social distancing should be respected. Back to you in the studios.
Thanks very much, Mercy Ashu, live there from Douala. The United States remains the country with the most reported confirmed coronavirus cases, with more than 337,000 persons already infected. In the meantime, the number of cases in Africa have risen to over 9,000 today. Gerard Nanji has updates on the coronavirus situation worldwide.
There are more than 1.2 million confirmed cases of COVID-19 around the world, with more than 69,000 deaths according to latest statistics. The U.S. remains the country with the most reported confirmed cases, with more than 337,000, followed by Spain with more than 131,000, followed by Italy with 128,000, Germany with more than 100,000 persons, and France with more than 93,000 patients. A total of confirmed coronavirus cases in Africa have risen to 9,198 on Monday, a substantial increase from 8,736 a day earlier. This comes in a coronavirus surveillance update issued by the Africa Centers for Disease Prevention and Control. So far, South Africa has a total of 1,655 confirmed cases with 11 deaths. Algeria has 1,320 COVID-19 patients with 152 deaths. Egypt records 1,173 confirmed cases with 78 deaths. COVID-19, according to the update, has spread to 51 of the 54 countries in Africa, the latest being South Sudan, that confirmed its first case on Sunday. The number of deaths have also gone up to 414 on Monday, up from 399 the previous day. A total of 747 coronavirus patients have recovered so far, according to latest statistics.
Auction for the first issuance onto other news stories of the fungible treasury bonds for 2020 will be launched on Wednesday, April 8. The government intends to raise 220 billion CFA francs from the exercise to fund its development projects. Ahead of the launch, Clarice Aritakang reports on eligibility conditions and what subscribers stand to gain.
The 2020 Finance Law authorizes the government to raise 320 billion CFA francs on the money market in order to execute a number of projects aimed at driving growth. Bidding will be done through banks approved by the state to conduct the exercise. They will be in charge of informing those who may be interested and willing to tender their bids. They include economic operators and investors who may be natural or legal persons.
The main actor of the operation are the dealers of government securities, which are banks. But any economic agent can subscribe. So what he has to do is to get in contact with his bank to express his intention to acquire government securities.
220 billion CFA francs is the amount to be secured during the first issuance of fungible treasury bonds for the year.
First interest of that is the return on investment. The rate of interest is higher than saving rates. For securities of 5 years, the interest rate is 5.7%. And for security for 3 years is 4%. Security for 2 years is 3.5%. And they have the guarantee that at the day, the payment, the reimbursement will take place at the due date.
With the auction date known, economists affirm that it will be a win-win situation for both bidders and the state.
Inhabitants of the Southwest region have applauded President Paul Biya's initiative to concretely start the reconstruction process of the Southwest and Northwest regions following the devastating effects of the separatist crisis. The reactions came after Prime Minister John Gutte appointed Minister Paul Tassong and John Donatus as coordinator and deputy coordinator of the reconstruction projects for the regions. Guy Roger Nana reports.
The reconstruction of the southwest and northwest regions of Cameroon following recommendations from the major national dialogue, some say is concrete proof that the head of state is pragmatic and keeps to his words.
Funds have been raised, and then we are at the stage, at the operational stage.
However, the indiscriminate execution of the reconstruction has been identified by many as a major prerequisite for the success of this initiative.
Everybody should benefit from this reconstruction.
Some major projects highlighted by inhabitants of the region include
social infrastructures, schools, hospitals, roads, the people themselves.
The population is very happy to welcome this kind of information. At least they have hope that at last they will have back their roads and their public and private edifices that were put down in most of the cases.
Meanwhile, business people feel that they should not be left out given their losses accumulated during the crisis period. It is, however, hoped that the reconstruction process in the southwest region will bring a new phase, leaving behind all the sad memories of the crisis.
And that ends the 7:30 news on CRTV. Join Adem Bala at 8:30 for the news in the French language. I am Moki Edwin Kinzeka Njaundi. Thank you for watching.